everybody, and thank you for joining us for the Ask Me Anything panel at NextBreath. My name is Linda Bowman, and I am an adult living with advanced lung disease, and I don't think I have ever said that out loud. And seeing the keynote, I'm a tiny bit emotional, so forgive me. But I will be moderating this session, and I'll be introducing our other speakers in just a moment. But before we get started with the session, I want to go over just a few items related to technology and how we can all interact. You'll notice both the event wide chat and the main stage chat that's on the right side of your screen. You can utilize this main stage chat to interact with all those who attend this panel. And if you would like live captions during the event, please click the CC icon located at the bottom of the video. Please note that captions are not available if you are using the mobile app to view the event. The focus of this panel is to answer your questions about living with advanced lung disease, navigating the transplant journey, or acting as a caregiver. We want you to submit your questions at any time by clicking the main stage tab on the right side of your screen and then select Q&A. We encourage you to like questions so that we can prioritize the questions we answer in our limited amount of time. We will do our best to answer as many questions as possible. And as a reminder, this question and answer session is not intended to be a substitute for medical advice, for diagnosis, or treatment recommendations. Do not make any changes to your own treatment plan without first consulting your care team. I know you know that, but we've got to say it. If you have any technology problems during the session, please visit the Tech and Program Support Room, accessible on the left side of your screen under the Help Desk tab. So a little bit about myself. I am living with advanced lung disease. My lung functions have gone down considerably in the last few years. I'm being followed for transplant right now. I was on oxygen a couple of years ago, but managed to get off of it, going for pulmonary rehab and such. So I will use it at night or for exercise, but right now I'm not on oxygen. I've been struggling a lot with culturing mycobacteria and possibly going for the phage trial this spring up at Yale, because I have 3 forms of Pseudomonas that are not being affected by antibiotics. And I have type 1 diabetes that I got when I was a young girl. I live with my husband, Mike. We've been married for 30 years. We have 2 cats, and I am a lover of butterflies and all things nature and animals. I'm a big fan of just caring for others, a little bit of a St. Francis kind of complex. But that's a little bit about me, and I'd like to introduce the rest of our panel, and I'd like Nicole to go next.
Sure. Thank you, Linda. And Linda, you know how much I love you, right? Everyone needs to know my love for Linda is just like never ending. Hi, my name is Nicole Kohr. I am a 29-year-old cystic fibrosis patient. I am a bilateral lung transplant recipient as of June 14th, 2019. I was born and raised in New Jersey. My husband, my mom, and our 2 large breed puppies moved to North Carolina this time last year. So I like to say that I've had the tour of East Coast hospitals. I started out at Robert Wood, then I went to UPenn for my transplant, and now I'm being seen at Duke. So I'm excited to participate in anything cystic fibrosis related, especially with the knowledge that I've gathered traveling to all these different hospitals. And this is my mom. Did you want to say something about you?
Sure. So, hi, my name is Patty. I'm Nicole's mom.
Not adopted.
Yes, she's my real daughter.
Wait,
even
if we
though
both smile at the same time, they can tell, right?
it's actually mine. Yes. So, but she, I've been Nicole's primary caregiver most of her life, and went through the whole raising a child with CF and helping her through adulthood with CF. And so I think we've kind of shared the road there. So I'm more than willing to answer any questions from my perspective as well.
That's awesome. And Frankie, tell us about yourself.
My name is Frankie Avila, and I live in New Orleans, and I am 48 years old. I was born with cystic fibrosis at 3 years old, and I also received a double lung transplant September 18 of 1995. So I've been living with my beautiful lungs for 26 years. In the process, I've also received two living related kidney transplants due to the immunosuppression and the effects of it on the kidneys. The first one was from my dad in July of '99, and the second one was, I'm sorry, it was in January of '99, and the second one was 10 years later from my sister in July of '95. I'm sorry, 2005. It was 10 years later. And the kidney has been working wonderfully. Always drinking water to try to keep that creatinine down. But the whole process has been, it's been amazing. It's been, a bunch of hills and valleys, and taking it day by day and just keep pushing forward. I've recently been married as of December of the past year. So my wife moved down here with her 5 adopted kids. So now I have a full-fledged family. The dog behind me is mine. Her name is Mia, and she's my little shadow. She follows me everywhere I go. So in regards to the caregiver, it's always been my mom who's the one that's been, watching over me and making sure that things were done accordingly, and everything was done according to the books, and what was best for my care. And I also was in North Carolina for my transplant, but I went to UNC Chapel Hill, so we got something in common with North Carolina. But I really enjoyed being given the opportunity to help with the Cystic Fibrosis Foundation any way that I can, because they've been an amazing organization since I was a little kid. Still an amazing organization, and they do so much to give back to to other people, just for the information, to help. There's everybody is always looking for something new, what's going on, and there's been so many advancements since I was a kid. It just blows my mind how far we have come, and I'm just looking forward to seeing what the future still holds ahead. Hopefully one day it'll stand for Cure Found. So any way that I can help, I'm always about it. With Great Strides or the Cycle for Life, or as in this case, just talking on the computer. Thank you for letting me be here.
Thanks, Frankie, and thank you, Nicole and Patty. That was an awesome share. I'm going to jump right into the questions.
It appears we have a frozen Linda.
Yeah.
Let it go. Let it go.
That's weird. Can you hear me? I'm not frozen on my end.
I can hear you.
Can you hear me, Nicole? I'm not frozen on my. Am I frozen, Frankie?
No, you sound and look fine.
Okay. I don't know what's
I'm
happening.
having trouble hearing Linda.
Yeah.
Okay. Maybe that's your end. I'm not frozen. But are either of you on Trikafta?
No, I have the nonsense mutation, so I'm not allowed to try it or even get on it. They wrote the prescription for everything, and then once they found out that I had the nonsense mutation, I wasn't allowed to continue.
Okay, there was a question for either one of you, because I'm not post-transplant, if you were on Trikafta and having any side effects. Can you hear me, Nicole? I think there's something on your end. Can you hear me, Nicole? Shoot. All right, well, we'll go to another question.
Okay, let's see here. I see in the chat here, just because we're having trouble
hearing. We can hear you now.
I can hear you now. Can you hear me?
Okay, well, let's see. I see this question here. It says, are there any other transplant patients who are on Trikafta and experiencing bad side effects? Yes, ma'am. So a little bit about my background with Trikafta. As a post-transplant patient, it's not necessarily encouraged for transplant patients to be on Trikafta. Some of us are. I started my Trikafta journey February of 2021, just the half dose. I did that so that it would benefit my sinuses, because my sinus disease was where I usually have Pseudomonas that was leaking down into my new lungs, and that's not good. And despite some weight gain and some, increased anxiety, I was handling the half dose okay. And my weight plateaued after reaching like a healthy weight. And then in October, I began the full dose, right? October, I think October sounds right. I began the full dose of Trikafta, and I that is there from a mental standpoint. I'm happy to elaborate on that, but for now, my doctor and I agreed that going back to the half dose was a good balance between benefiting my sinuses and I wasn't feeling as anxiety ridden.
Thank you. Thank you, Nicole. There's a question that came up regarding, are you embarrassed by your breathing treatments and or vests? I'm assuming, Frankie, you aren't doing that now. So that would be for me, and I would say no. I'm not embarrassed by them. In fact, I'm kind of the opposite.
Let's see. Am I embarrassed by my breathing treatments or vest? I used to be. When I was a child, I hid my disease from the world because I was in the performing arts, which was a very discriminatory field at the time. If there was any reason to be not cast in a production or just kind of your friends, there were a lot of reasons why I decided to hide it, in addition to embarrassment. Also, when you have CF, you're very productive, you're junky, you're snotty. And, as a teenage girl who's just trying to wear a cute top and crop top and make it through high school, that's not exactly the symptoms you want. So I found different coping mechanisms in writing and humor, and those kind of helped balance the embarrassment of cystic fibrosis. But as an adult, absolutely not. I am very transparent with how I'm feeling, the medications that I have to do. And I think to a degree, people like hearing the routine because they like the transparency aspect. They like to know when I'm doing a neb, this is how I clean it, or things like that. And if anything else, I'm giving tips and tricks to my sisters in fibros.
Thanks, Nicole. Can you hear me now? No, okay. We are so sorry for this technology problem, but we hope you bear with us. I would basically be answering the same way. I was starting to say, no, I am not embarrassed by my treatments. I know that that's what pushes me and keeps me from hopefully declining even more. I think for me, the idea of declining scares me enough to do whatever I can to help myself and to not decline. So I'm not embarrassed about treatments. I'm not sure if there's more context to that question. And if you want to write something in the Q&A to further that, that would be awesome.
Well, I'll answer my portion. Um, as a kid, growing up, basically in elementary, I was called the pill popper for taking my enzymes, and that really affected me mentally. And I was embarrassed to do my treatments anywhere outside of the house. I didn't want other people to know that I had CF. I didn't talk about CF. I just kind of wanted to try and pretend to be as normal as possible when it's very hard when you're coughing and you sound different and everything that goes with it. So as a kid, I was definitely embarrassed to do my treatments. But I stuck with it because I knew that if I didn't do them, I would end up in the hospital or worse, just getting continuous infections or whatnot. I didn't have the opportunity to have a vest, so we had to do it the old school way with the CPT. And on vacations, eventually in college, I just came to a grip of basically accepting that this was my life. This is what I was going to have to do. And, the friends that I found accepted me for who I was and what I had to do. And they actually became a part of the journey when we went out of town. I would do my nebulizer or whatnot, and they would actually do the CPT for me. So in regards, as I got older, the whole being embarrassed kind of went out the window. And one positive thing is my wife, she has PCD, which is also another respiratory disease, and she does her treatments in the car, and which is amazing that when she has to do them, she'll just do them in the car, and we just go along like it's normal. So I think a lot of it is how we look at it and how we accept it ourselves. And I think once we accept what we have to do, it makes it a lot easier to continue doing it, regardless of where you're at, what are you doing. So it just kind of helps to make it a little easier to accept it.
Yeah, I agree. Frankie, you do not believe this, but I still get CPT from a respiratory therapist, like a licensed RT comes to my home every day. And that's just because I'm not a fan of the vest. I think CPT is better, but that's a personal choice.
Yeah.
Our next question: if there was one thing you could do differently in preparing for or waiting for transplant, what would it be? And I'm going to just give a quick answer to that in regard to when I was told that I needed to look into transplant, it freaked me out, to say the least. I didn't really want to deal with the idea of that. I had never thought about whether I wanted one or not. And the more I talked to my doctor and also the research doc that was at my clinic, and the more they said, Linda, if you're really not knowing, at least go through the motions, at least check it out, because you don't want to be in a place where your numbers fall and then you're not being seen by anybody. And that made so much sense. And it gave me comfort because I was really struggling with my complications that I have with my age. I know so many people who have had transplants that are, much younger than me. And I thought, I don't know. But that idea of finding out and letting somebody who knows what they're doing, meaning a transplant doc, to let you know where you're at, what your options are, just finding out everything from socially, from support, from your mental abilities to physical abilities, everything that you don't really think about when you're first introduced to the idea of transplant. You need to just thread through all of those things and take as much time as you need, because I love the idea that the CF Foundation has changed the protocol, right? The idea that years ago you had to be down to 30% before they'd even look at it. Now that with the new lung transplant initiative, the numbers are higher when you can start talking. So when I got down to 40%, they're like, you know what, you need to think about this. And then when I went down to 33, I already was in the process of speaking to somebody, which was so helpful, because you don't want to be in a place where you're kind of caught. You don't want to be in that place where you're so sick. So I love the idea that, one, we don't say end stage disease anymore. How freaking fabulous is that, right? It's advanced lung disease, because none of us know what our inner strength is until we have to use it and call upon it. So I think it's just, we're moving in a very positive direction when we talk about our options, when we talk about our life, and it's not all or nothing. It's not life or end stage. So I just wanted to share that. If any of you want to take that question.
The thing that I would have changed was that I would have, in a sense, taken better care of myself. Growing up with CF, I always wanted to just be normal. I didn't want to have to worry about taking a treatment. I didn't want to have to worry about doing my meds. But at the same time, I always did it. But there were many times, college, basically college, I was going out, I was, going to bars, going to clubs, doing everything that I really shouldn't have been doing, knowing that it was going to have an effect on my lungs. So in a sense, I kind of wish that I would have taken better care of the lungs that I did have, because it may have been able to help postpone the year, the age that I was told that I was going to require a lung transplant. I was told at 19, I was still in college. I was still, trying to go to class, trying to do everything possible to graduate. And now I'm told you might want to look into getting a transplant. Your lungs are whatever the percentage was at that time. Within 2 years, you're going to be in some serious, you're going to be in a serious critical condition if you don't start doing it now. So I would definitely have liked to take care better of the ones that I did have.
Yeah, that's great advice.
Yeah, I never understood the term end stage, because, kind of like Linda said, it's such an abstract concept, and there's such a range that I didn't know how sick I was when I reached end stage. I had been going downhill for such a long time that I had adapted to things like oxygen, to things like, oh, it's only half a beaker of hemoptysis, which is blood, like things like that you work into your daily life. And yes, if I reflect back on that now, I was in a very bad place. However, it took the transplant evaluation doctor to tell us, you are in end-stage cystic fibrosis, and you'll probably be at the top of the list. I mean, granted, at the time, I was about 79 pounds. I was on 6 liters of oxygen, and my FEV1 was about 11%. And they said, you had how many weeks, like, before we need to squeeze this in?
But it happened really, really rapidly. You know, it kind of went from, even though, like Nicole said, she was going downhill progressively, you know, I think because we had just kind of gotten used to where she was at, we really didn't understand how sick she was at that time. Like, you did, but you didn't. You didn't realize how close she was. And her doctors had wanted to set her up for transplant evaluation actually before we ended up doing it. But there was some timing issues and things. And so when we finally did move ahead to go for the evaluation, it was kind of like, you know, you may be a lot closer than you think. And then within such a short time, she really went downhill tremendously. And then, you know, they just said, you have to do this. And, you know, Nicole was on ECMO, and she was really, you know, really close to the end, honestly. And so it was very hard to just kind of go like that. And, but I think what Linda said and to what Frankie said, you know, I think kind of, one, taking care of yourself beforehand, and just making sure everything's done, but also having that evaluation early, I think really is a big thing. I think not being afraid to have that evaluation, because a lot of people hear transplant and I think it's terrifying, and it is for all of us. But at the same time, it is so much better when you already have that relationship with that team. And so that at least when that day comes, if it comes, you know, you already feel comfortable and you kind of know what you're going to be going in for and what's going to be needed of you. So,
yeah. Plus, now that it's phrased like a treatment option instead of a last result,
you
know, like, or a last resort, rather, it's easier to wrap your head around being able to do it. You know, I also thought to myself, like, prior to my transplant, is this something that only superheroes can do? Because, like, I would see the people who would go through this, and I would see these terrifying pictures, and I was like, I think I'm strong, I think I'm tolerant, but I don't know if I'm one of those people. And the resources that they have available to us now, yes, it is very doable. But I understand what Lisa's saying, what Linda's saying as well, is that it's a personal choice. You know, you, depending on your age, depending on how far along you are, your FEV1, your tolerance, it's all just a matter of abstract ranges now. It's what do you want out of life, and how far are you willing to take a risk with your current lungs and potential future lungs. But overall, the general message being, just do everything you can to take care of your birth lungs. It's an analogy I always used when I'm speaking with medical students. I always refer to it like laundry and washing machines, right? So you start out with this like brand new washing machine, and you're going through with all your laundry, and it's fine at first. You can maintain it easily. After a while, you'll need new detergent because the other detergent doesn't work anymore. Sometimes you'll need a dry cleaning service to come in because you got a bit overwhelmed. The new detergent wasn't working. Then you got back on track. And eventually you have to make this really tough call because your washing machine has been making this weird like banging noise. And you're like, I can't decide if I should like take a leap of faith and just get a new one, even though this one might last longer, or if I should just hold on to this one for dear life. And it's everyone's personal call. So that's how I like to think of it in just the simplest terms.
I love that analogy.
That's a good one. That's definitely so true.
I love it. And you know, you bring up a good point, like it's a treatment option, right? The words are so important. And I just live in that world that words are so important, but particularly in CF. I mean, they really have such a powerful connotation when you're talking about things like critical care, transplant, life and death situations. And I think, years ago, I remember it was like you were either going to die or you might be lucky enough to get a transplant. And it's not like that anymore. It's not easy. It's complicated, scary as hell, right? But it's not the same as it used to be. And I think because of us learning as a society of being careful about how we word things and how we present things, it means so much because now we have that opportunity to think about things in a big, broader view without all of the fear at the top. It's scattered throughout, right? So I think that matters, and it helps us develop the skills that we can put these things in a place, and we can compartmentalize, and we can look at one thing at a time and say, okay, I could deal with this now. Maybe not this, but try tomorrow. And I think that's been helpful for me.
I definitely love where we're at now regarding information for transplant. There's so much more of it out there, and just like you said, Nicole, you're looking and you're deciding, you're wondering, is it the right thing for me to do? Should I wait or whatnot? The best part about it now is that there's so many people out there that you can ask questions to. You can ask them, hey, what did you go through? How was it for you? What did you think about, when your doctor said, hey, I think it's time for you to think about it. When I was told, I was in the hospital for a tune-up, and it was just my dad, my mom, and my sisters. And he basically walked in the door, shut it, and said, we have to talk. Right now, according to what your lung function is, you have about 2 years. And he said, the choices that you have, just like you said, lung transplant, if you're lucky, and then, death. So the way things have changed in wording and, in a sense, empathy for others, it kind of gives you a little fresh breath, definitely more hope. And you don't look at it as like, oh my gosh, I'm going to die tomorrow, but you can look at it as, okay, there is that choice. There is that option. Let me look into it. Let me see what's out there, and let me see, what, like you said, I can think about it. I can look over it, and I can, decide on it and see. And I definitely agree with doctors informing us way earlier than what we need. Don't wait till the last minute. If you have a physician that's just kind of saying, yeah, we're just going to continue to treat this, we're just going to continue to treat that, but you're not getting better, you're not changing, and you in your gut feeling, saying, wait, something's not right, push them to question. And if you have to bring it up, just bring it up and say, look, I've seen info, I've been, talking to others. What do you think about this? And, just get that conversation started in case there is an opportunity for them to say, okay, this is what the options are out there.
Yeah.
We've got a few more questions. The next one is, who in your network / support system provides you your strongest emotional support? It's an interesting question, and usually you think about your family or your partner, or but Frankie, you just mentioned about the resources now that we have, people who have experienced transplant, like in our community, and now they're a valuable, wonderful resource. And I think about that for me because yes, I have my loving husband. I do have a small family. My parents are gone. I have a sister and a brother. And my best friend is a great support. But I never really reached out to a lot of CF people I always was a little bit, I don't want to use the word shy, reserved. And it was a protection kind of a thing. I was worried about getting close to people with CF, and then either I would die or they would die. And it was all that mix of emotions of being scared to get close. But I have moved past that, and I have found the most unbelievable friends in the CF community that I would go to in a minute and ask them, what's it like? What was it like? Please walk me through it. Hold my hand. Hear me when I'm crying, when I'm sitting in my closet on the floor. Oh, and they have been just incredible support because they have known it, walked it, breathed it, not breathed it. They have been there and back. And when you have somebody like that in your corner, oh my gosh, like talk about emotional support. It's just so, it's rare, and it's awesome.
Mm-hmm.
What do you guys think?
Yeah, absolutely. I like to think my support system is split into three parts. So I have people like my mom who are my sympathy. They're the people who let me feel my feelings when I need to feel them. Sometimes you need to cry. Sometimes you're like, this sucks. And this is the person I can go to and just say, can I just cry with you for a half hour and just say how bad the situation is? You need that. Then you need people like my husband who are your strength. These are the people who are like, I don't know why you're doubting yourself. You are a bad bee, right? You are an amazing, strong person. You should have no doubt you will get through this. So you need that. And then the third part it's people like Linda and Frankie, people who have been in your shoes, and you can exchange pictures of your gross liquids and just say, is yours also this color? Should I consult a doctor? Because you need that too. And so without all three parts, something would be missing to me.
Yeah.
What do you think?
Yeah. Oh, I mean, of course, from your perspective, it's a little different than from mine. But when Nicole wasn't diagnosed until she was 5, even though she was sick from birth, and it took me going to a million different doctors and dragging her around and saying something's not right. Please take a look at her, and for them to finally diagnose her. And when the year she was diagnosed is the same age she is now, is how old I was. So, I was a single mom then. I had been divorced already, and I was, handling all of this, and there was no resource for me. There was nobody to say, hey, there was hardly anybody that I could talk to, and you kind of had to just go on your own, faith on things and common sense. And unfortunately, because Nicole had 2 nonsense mutations, all of the things, all of the books, all of the material about CF that was, this is what's going to happen. Hers didn't happen that way, and just so she was always like that 1% that didn't, present the same way as everybody else. And so even in her own clinic, like, we were always kind of the guinea pigs on things. And it wasn't until, a little later that, as she got older, that there started to be resources where we could, talk to other families and talk to different people. And I think for younger people that are being diagnosed now, that's just phenomenal, because one, everything, the medications and everything are so much better. And then on top of it, the resources, like you said, for them to talk to people and just share those things for both the families and the person. So yeah, it's just great.
I totally agree with you, Nicole, and Linda. I think it's definitely more than one part. Mm-hmm. You definitely need your fellow CFers, that have been there, that have struggled, that know exactly those feelings. As soon as you start talking, they're like, yeah, I know exactly what you mean. I personally did not do anything with the CF Foundation until after I was transplanted. I did a few things beforehand, but I never connected with many because unfortunately in the process, I've lost all my CF friends that I grew up with, all of them. So I just kind of, stuck to myself and just kind of, hey, whatever I need to do to keep going, I'm going to do it. Whatever they wanted me to try, I was going to try it. I wasn't going to sit still and let CF define me or let CF take control of who I was and what my future looked, what the future had in store. But definitely since I've met so many other CFers and transplantees, it's been so amazing just to be able to say, hey, did you have to go through that, or how did you do that, or what did they tell you? And then just for others that are having a bad day, you can, tell them, hey, you are a bad bee. You're going to get through it. So, and that's how it was, when I was single at the same time. My main support was my mom. She was the person that I went to. She could understand exactly what was going on just by the look of my face. My expressions were written all over my face, and I didn't have to say anything. She knew what was going on, and she was there to support 100%. Whether it was just to sit there, talk to the doctors, go to the clinics, whatever it took, she was going to be the one to sit, to be there. And then once I got married, like your husband, my wife does the same thing. I could be doing something and she's like, oh my gosh, that was so amazing. And I'm like, not really. I've done it before, because you're so used to doing the same thing all the time that, for somebody else to tell you, wow, you really make me feel like a stronger person. You really make me know that I can do it also. And so, it does have its effects on, others that are around you. And so I think for vice versa, for me and my wife, we kind of go back and forth with that because she has respiratory disease also. So, you definitely need the three parts are really, really, really good.
Yeah. I think we're all in agreement on that one for sure. And the other emotional support is if you do have a good relationship with your dogs.
Yeah.
We don't want to leave that out, and it's important. There's a question here. What was the time frame for Nicole and Frankie, the wait time before you got a transplant?
So for us, I was evaluated in March 2019. And like we said, arguably, I needed to be evaluated sooner. But we also were delaying the inevitable because I was due to get married on June 1st. So between the months of March 2019 and June 1st, 2019, my husband and I were accepting two different kinds of calls. One call would be like, what napkin color would you like at your wedding? Would you like eggshell or cream? And then the next call would be like, do you have a living will? And it was such a weird, what a weird time. And just emotionally, at least, I was not where I needed to be. Kind of like Mom said, although I had declined over time, the transplant discussion came a little too last minute, I think, in our case. And so it was rush, rush, rush. There was no time for thinking or emotion. We kind of had two choices. You were going to die or you got a transplant. Yeah. So I was transplanted June 14th, 2019. So in my case, it was just a few months. But in most of my friends' cases, they're on the waiting list for a long time.
Yeah. And that's really the better
way. Yeah.
Yeah. I mean, we were basically just told, like, she's going to die. You
need
do it
now.
You need to do this.
Yeah.
You need to be put on the list. And And in between that, like she said, she forced their hands that she was going to go ahead with her wedding, which she did. And then 14 days later, she got her transplant. So.
I like to keep it moving, multitasking.
That's awesome.
It was an amazing array of pictures.
She actually planned her wedding from the hospital bed. She really did.
I did.
That's amazing.
And
mine was 2 years.
2 years.
I waited 2 full years.
Wow.
And you feel the 2 full years. But in a sense, it was good because, I was able to stay, since I was going to have my transplant in North Carolina, I was able to stay here in town until I was going to get closer to the top of the list. And so I continued with school. I went to school every day. I was in college at the time, and I went every day until towards the end. I started getting, I was more worn out, and I was getting sicker. So I was having to go in the hospital, and eventually I just had to stop going to school. And then that's when they called me to go up because I was closer to the top. And that was a full year's wait. But it was kind of good in a sense because I was able to get my mind where it needed to be, and they pushed physical rehab. So I was able to get my lungs stronger. I was able to physically get stronger and be more mentally prepared, when the time did come.
Yeah, even as you both discuss your wait time, I think it's important to whoever's in the audience that, we stress that it's absolutely individual, right? It's just,
yes.
There's so many factors and variables that, the size of your lungs, your blood type, how critical you are, where you are on the list. I mean, it just goes on and on. So,
but definitely don't be afraid to have that conversation with your team too. Yeah.
Exactly, and I think that's what we keep kind of going back to, that don't wait. Have that information given to you so you can have that time while you're still breathing somewhat comfortably. That you're not filled with anxiety about a life and death situation. So I think that's important. There's a question here. Do any of us have any experience pre or post transplant with CFRD? And curious what you do to manage with challenges like the CF diet. For me, I've had type 1 diabetes since I was 16, and it was hell. I went right on insulin injections. I was up to 4 to 5 shots a day. I was hospitalized because I was the high schooler who didn't believe I had diabetes and, passed out in high school and ended up in the hospital in the coma with the 800 blood sugar. And so I hated it. And it took me years to accept it, that I had another separate disease, and that I had to learn to live with it. But I do well now. I've gotten my A1C pretty much under control. I'm on an insulin pump. It still is a struggle. I still, go up and down. But the CF diet thing, that part of the question is interesting because I've never been, let's say, I've never followed the instructions of the CF diet. Like back in the day, they told you to eat all kinds of fatty, crappy, like
Put whatever you can.
KFC.
Garbage. And all I kept thinking was, in my hopeful heart, was one day when they cure this, I don't want heart disease.
Yeah.
I just always felt like that. So I never did that crappy fatty diet. And then thank gosh it's not like that anyway now. They don't eat that fatty. And I'm thinking, geez, what about us people who were told to eat that stuff and now they have high cholesterol? It's crazy, right? So has always been, I try to watch my carbs. I eat healthy fats. I eat potato chips, but I don't, it's not a majority of my diet, and I have always been more on the holistic side. I do. I know there's a question here about plant-based diet. I'm not vegan by any stretch of the imagination, but I do try to eat uh, more holistically. So you guys take that away.
Frankie, did you want to
Um,
go first?
yeah, I'll just be quick. Before transplant, I didn't have any issues with diabetes. So I ate all the bad food. I ate anything that was fatty, anything that was high calorie. And my downfall is sweets. I love sweets. I have to have a sweet snack after every meal. So that was my downfall. But after transplant, because of the prednisone, I became diabetic. And at first it was type 2. I was, you're able to control, just change your diet, do this, do that. And I tried, but it just continued to get worse and worse. And I think that was kind of the downfall of my kidney also was, the diabetes played a huge part into it. So eventually, now they consider me type 1, and it's just been a struggle, a serious struggle. I've started getting better with my eating because one time my A1C was over 8, and I about died when I saw that number. So I started, getting better at it, and it's been, going up and down, but it's much better. And finally, after many years, I got the Dexcom, and I was able to try it, and I was like, oh my gosh, this thing is amazing. So as much as I didn't want to go, get attached to anything or tied down to anything, it has truly been so helpful. So I'm still on the path of eating my sweets, but at least now I can see where I'm at on the trend, and I am definitely working to eat, just to continue to eat as healthy as I can, which I really do. I like to grill a lot, so try to get not fatty, non-fatty, and just healthy foods on the grill, and a lot of this, a lot of just different ways of cooking it and things like that. But yeah, so it's been a struggle, but we're getting there. We're getting there.
Yeah, my journey is similar to Frankie's. So I had no diabetes issues pre-transplant. I ate fast food for breakfast, lunch, and dinner. And I was not a sweets fan, but only because I was so gunky all the time that like dairy and chocolate and all that tend to make me feel like I couldn't breathe. But yeah, a bucket of KFC, hot dog eating contest. I was that person with no regard for my heart. I was like, this is how I will die. And then after transplant, I was still fine up until January 5th of this year when I was driving to, McDonald's or something like usual. And I called my mom and I was being nasty. And she was like, what's wrong with you? And I was like, I don't know. And I was having a temper tantrum in the car. I started to not be able to see, and I couldn't remember where I was going. Something was wrong. And I had been like that for a couple of days, like a little over a week. I'd been like that. So the only issue I'd had in the past was like high blood pressure. So I was like, maybe I'm having some high blood pressure. So I drove home, took my blood pressure's fine. But I did a blood sugar stick just because maybe it's low or something. And it said high. And I'd never heard that before. I thought my machine broke. So I called my doctor and I was like, it just says high. And they were like, that means it's over 600. And I was like, okay. So Jared drove me to the ER. Again, this was January 5th this year. To the ER, I remained at over 600 while I waited for like 900 COVID patients to go through the ER, poor things. Then I was seen and they gave me insulin drip. They gave me a sepsis protocol of hydration. And it turns out that, same as Frankie, my prednisone had induced steroid diabetes or CF-related diabetes. And my A1C was 10.1. Bad, bad, bad. And apparently I had been on this diabetic journey since probably a few months prior to that. So if you're like me, a few symptoms to look out for: you're nasty for no reason, you can't see, and you forget things, and you're ravenously hungry and thirsty. Those would be the big signs to look out for. But now I'm fine. I'm on insulin. I guess my toxicity broke, so it's way more stable now.
And she cut Trikafta in half.
And I cut Trikafta in half, which probably also added to why I was being a crazy person. But yeah, diabetes.
Not a pretty picture.
No.
No. I remember those A1Cs when I first was diagnosed. Mine was 11.6. And I had no clue. I was just, I was walking out of the CF clinic, and just as I'm heading out with my mom, the doc said, "So nothing else is new, right?" And I just happened to turn around and say, "Well, I'm starving all the time and I'm thirsty like crazy." And he's like, "Get back in here." I didn't know anything about diabetes. So yeah, crabby, thirsty, look out, right? But
the other thing that I noticed was that I was eating a lot, but I wasn't gaining any weight.
Right. Yeah.
I mean, I was eating everything and no weight. I just, none of the weight was staying on me. And then once I was able to get it under control, then the weight started, I was able to gain some weight with it.
Yeah. And it's interesting because now they're verbalizing more how uncontrolled diabetes does really have an effect on your lung functions. So just to put that out there and be aware of that. There's another question here. Do you ever feel like the disease holds you back from achieving your goals and dreams?
You can go, Nicole.
Yes, I think it does. And that was actually the reason that I started writing Fall Risk the Musical, is because my only dream was to be in the performing arts. And it didn't matter how many meds I did, how hard I worked, my body was telling me this is not the path for you. And there are often times when you have a chronic illness that your path toward a dream has to change. And I think just the mental health side of that has to be you being prepared for that and, being okay with kind of just going along with the ride, if you will. I physically wish I could have had my BFA in musical theater, but I went for public relations instead because I wanted insurance and a 9-to-5 because, how am I with an 11% lung function going to upkeep a dance audition or something like that? So,
yeah. I don't feel like I didn't want it to make my course. I didn't want it to tell me what course I was going to take. I knew that I couldn't do certain things. I knew that I wasn't going to, when I was younger, I wanted to be an astronaut. But because I love science and I love space, but I knew in my heart and my mind that you're not going to be able to do your treatments up there. You're not going to be able to, your lung function. How are you going to handle all the tests that you have to go through? So I just changed the course that I went, but I wanted to stay in science. And I was told as a kid, you don't want to do science. You just want to do something general studies. So it's easy. You can get it over with and you can be done. well, that pushed me in a sense to say, well, I'm not going to really go by what your standards are. I'm going to go with, the direction that I want to go in and try and fight and, see where it takes me. And my biggest, the biggest thing that I had growing up was faith. I just kept trusting in God, trusting in God. The days are going to be hard, the times are going to be hard, but as long as I kept trusting in God, He was going to make a way for me to get. He was going to make a way for me to get through it. So I just kept pushing and pushing, and of course, we can't do everything. There are times where I know that I can't do it, so then I have to go in a different direction. It might take a little longer, but it's a different direction. And as long as I'm getting close to where I want it to be, or, if it's something just as satisfying or fulfilling, then I'm okay with it. But in the end, I was able to graduate with a science degree. I got two science degrees, and I was able to go into medical technology. And that was something that I really looked forward to, because growing up, we had so many people help us: nurses, doctors, respiratory therapists, people that just brought us the food, people that just brought us games to play with. And my thought process, well, since I can't be a doctor, let me go into the lab world, and at least I could take care of behind the scenes. I can reduce my risk of being, reduce my risk of infection by being around other patients, but also I can do something to give back, and making sure that their test results are done with the highest quality and standard of care that I can provide has been very satisfying, knowing that I'm able to give back to others who have helped me get to where I am today. So
yeah, I feel for me that question causes lots of stirring. It's a complicated question, I guess, for me, because I never really had goals growing up, because I grew up in that age of, you're definitely not going to live long. Life expectancy was like, 8 to 9 or 10. And I grew up with dysfunction in my family, so I became very much a caretaker. And so I had dreams for sure. I always wanted to be a dancer or a singer. I wanted to be on Broadway. And the other dream was I was really fast and used to beat all the boys in races. So I wanted to go to the Olympics. And I wanted to be the first girl to, like the Joyce, what was her name? Joyner, somebody. But
Yeah.
And, so I would do the races at school, and I would win the little gold medals, and I would beat all the boys, and I would think I was a badass. But then as I started getting older, I couldn't keep up, and I couldn't do those kind of things. And my mom never put me in dance. And she always felt bad about that later, that broke her heart. But there were dreams for sure, but I didn't set out to pursue anything per se, because I was so wrapped up in I'm not going to be here probably, or taking care of what was going on at the house. And then later in life, I found, because I always had a lot of faith, and I always knew like there was a place for me to use my voice and to use my caretaking abilities. So I ran a youth group for years. I mentored children through the YMCA and the programs with SOS. And then I found a voice in CF, which I kept a secret like my life until 27. And then I came out of the closet, and started using my voice there. And I feel like now, as I'm older, I feel like I'm living more authentically, living more dreams, let's call it, than ever before than I did when I was young. And I want to say that people now with CF who are growing up now, oh gosh, please do not get caught up in life expectancy. This is a death sentence. Please, 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 I beg of you to hear this message. There's no reason for you to go down that road. Like, live your life, be your best self, live the fullest you can, because there is so much out there now regarding treatment, regarding transplant. Just the whole world in CF is so incredibly different than when I was a kid. So just that question makes me think, who's worried about that? Who's feeling like that, right? Like it stirs something, and I see it even on social media in the CF community, like the fear for young people. And I think, no, we've got to have a talk, because, and that's not to negate the tough times, right? That's not to negate the tough scenarios when people are sick and people are still, unfortunately, dying. So, but keep your mindset around the idea that there's a lot more now than there ever was. And you stay focused, that you can follow dreams, and have goals, and set out, bring them to fruition, right?
Yeah. I always say never lose hope.
Yeah.
Keep pushing forward and just keep going, and live every day. Live every day.
Yeah. It it's there's a question, and you both will have to answer this. Can you describe what the process was like for you in identifying a match?
Ooh. For me, I know it was someone who was petite enough. They specifically wanted me to have husky boy lungs. It's like sewn into my memory. But it was just because of I was so thin at the time. We needed something to squeeze into my diaphragm. That was the biggest goal.
One of the other things was because Nicole did need lungs really late in the game. We had such a short time frame that essentially we had to be willing to take high risk lungs, which is something that they explain when you go to, kind of your transplant evaluation. But high risk is typically, from an organ donor that maybe was a drug abuser or something like that. And so because we were told that if we did not go that route, that we would probably be waiting a lot longer, and she essentially may die before she gets the lungs. Yeah. So we did go that route.
Mm-hmm.
I know that they do go according to your size. Mm-hmm. They have to have the lungs fit inside your chest, and it can't be someone our size or larger, because the lungs probably won't fit. Right. So normally they do go smaller. The individual is smaller than us, so they know that when the lungs expand, it'll be able to fill up your whole chest. Mm-hmm. Otherwise, in the regards, they do our blood type matching, they do our HLA type matching. Mm-hmm. They do a lot of that matching behind the scenes. Mm-hmm. And really, it's not until they actually go out and go to procure the organ that they really can tell whether it's going to be a match or a fit for you. I had one no-go. They went out, went to the ER, got ready. They had gone out to the center, but the lungs started filling up with fluid. So that was a no-go for me. They weren't going to take the lungs back. They were, they may have been able to use other organs, but the lungs are pretty sensitive in regards to how quickly they can bring them back, and how sensitive they are to really the surroundings. So they really check all that. So that's, and I don't know who my donor was. For the lungs that I have now, I was never able to find out.
Linda, you're muted.
I'm sorry. One more time for one more question. What are your thoughts on going to events with large number of people, even if masked and you are fully vaccinated? For me, I don't go to events with large number of people, even if they're fully vaccinated. I'm too nervous to do that. I've got several different, bacteria going on, and the last thing I want is COVID. So, yeah, no.
Yeah, we're the same. We just kind of take it day by day, and if there's something that we absolutely have to go to, we really keep our distance from everybody else.
Yeah.
But we limit things that we go to like outdoor events where we're not even near people, and we're masked and we're vaccinated. So it's that's like the max, of what we're willing to risk.
Yeah. Outdoor events is
yeah.
But indoor, not so much.
By the way, this is my wife, Amber. She's the new caregiver now, which has been a total blessing. But
he's pretty easy.
We both kind of think exactly alike. And to be honest with you, I wasn't one to wear a mask before transplant, even after transplant. I wore the mask when I was told that I needed to wear it, but I didn't wear it otherwise. But once COVID hit, and I met Amber, that changed all the rules. And everywhere we go, we wear a mask, whether it's outside, inside. And we do try to avoid large crowds, especially when there's a lot of people. A lot of times we've gone places and there was just people everywhere,
too many people.
And we would just leave.
Yeah.
We kind of, scope it out, see where it's at. And we would make our ways to areas that's not, not as full or congested. And we may stay back there, continue wearing our mask. But, I did get COVID. So even more to realize, to wear the mask, and we're both vaccinated, boosted.
Yeah.
So I personally believe in the mask. I personally believe in being vaccinated. It's not a cure for sure, but it definitely helped prevent me from having to be hospitalized.
It really did. I mean, it was fine.
Well, thank you. We are out of time. I wish we could speak more, but this was so awesome. So I need to wrap up. I want to thank you guys for speaking and sharing your stories. Nicole, Patty, Frankie, and Amber, thank you. And I want to thank all the audience for your attention and for your questions. And I hope that you will stick around because the closing event is going to happen in about 5 minutes. And if you stay in here in the main stage, that's where it will take place. So don't go away. Stay for the closing and have a great night. And thank you so much. Bye-bye.